Every year, 1.5 billion people die from stroke. 70% to 80% of people will lose their ability to care for themselves due to hemiplegia, speech, and swallowing impairment. More than 80% of patients have upper limb dysfunction after a stroke. There are different types of strokes. Among them all, ischemic stroke is commonly diagnosed. It mainly occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. To improve their disability, the hospital is suggested to take rehabilitation courses and ongoing physical exercises. However, rehabilitation requires a lot of manpower, and it is costly. Currently, there are 4 types of rehabilitation systems: N-traction upper limb robots, gamified N-traction robots, VR screen-based training systems, and confrontational rehabilitation robots. Some of them seem to be too passive for the patients that they feel like a tool, while some of them do without feedback. Different from the traditional rehabilitation methods, our robots can provide repetitive and meaningful tasks that make the rehabilitation process smarter and more efficient for patients during upper extremity rehabilitation for stroke patients. Therefore, rehabilitation robots are being used more often to assist patients during their rehabilitation training. In the interview with Dr. Gary Lau, who was subsequently awarded a PhD in clinical neurosciences at the University of Oxford, also the director of HKU Stroke Association, said that 30% of the patient may suffer from mental illnesses among 14,000 people every year. Therefore, in our robot system, NDCC, the non-direct caring collaborative rehabilitation assistant robot, the patient needs to grab the plate. Once the robotic arm sensed that the patient had shown fatigue in muscles, then the robotic arm will grip the gripper and help the patient to move the plate to the destination. It aims to use the Hanoi game to provide emotional support, physical activity, and cognitive training. Apparently, moving the plate in different sizes and colors might be beneficial for the cognitive and physical part. To help the patient achieve the goal could help them gain satisfaction. For the robotic system, it needs to sense that the patient needs help in time to give the appropriate level of assistance, and allow the patient to trust the robot in their interaction with the system. Level 1. Level 2. Level 3. The system must be able to monitor and process the user's level of fatigue. The analysis of EMG signals is used as a criterion to determine the level of muscle fatigue. The NDCC system means that the robotic arm does not directly touch and hold the patient's upper limb as a traditional robot would, but rather works in a cooperative way to complete the task, picking up and moving objects together with the patient when they need them. The purpose of the NDCC system is to avoid excessive interference to the patient during rehabilitation training, which is beneficial to the patient's cognitive and motor function recovery. Although there are still a lot of challenges, in the future, it might become a more mature project for stroke patients and to be commercial use.